بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. حضورنا الكريم، معكم أخوكم خالد بالهول من برنامج دبي للتميز الحكومي. يشرفني أني أكون معاكم اليوم في هذا الويبينار اللي يصادف العشر الأواخر من شهر رمضان الفضيل. والله يتقبل طاعاتكم وطالع أعمالكم ويبعد عنكم الشر في ظل هذه الظروف. الحقيقة في البداية حبيت أشكر تواصلكم وحضوركم معنا في جميع المحاضرات السابقة، ولذلك وبإذن الله مستمرين معاكم في لقاءات معرفية في المستقبل اللي راح ينظمها مركز المعرفة والابتكار بعد إجازة العيد، وبموافيكم عن تفاصيلها قريبا عن طريق الموقع الرسمي أو وسائل التواصل الاجتماعي. والآن لو تسمحون لي أستكمل حديثي باللغة الإنجليزية. Good morning everyone. Good evening to you, Dr. James. I know you're on the other side of the world, so thank you for being with us at this time.
Thank you for having me.
I hope you and your family and loved ones are safe and healthy. Great meeting you earlier, Dr. James, and if you allow me to introduce myself to the esteemed audience. My name is Khalid Bilhol from Dubai Government Excellence Program, and before we start, I would like to thank all the attendees for being present today at the webinar and for their continuous support to our previous sessions. Your engagement and involvement have encouraged us to continue with our webinar sessions after Eid holidays under the umbrella of the Knowledge and Innovation Hub. So please follow our latest updates on our social media, whether it's Instagram or official DGP website. Also, the presentation is available for you at the handout tab for you to download. Today's topic is a very interesting and relevant topic. It is about how to use big data and artificial intelligence in crisis times. Please allow me to give you a quick introduction on our respected speaker, Dr. James Faghmous. Dr. James Faghmous is the founder of WSDM.AI, where he guides companies and governments to build world-class data science teams and value-adding AI products. Prior to WSDM.AI, Dr. James was a professor at Stanford University as at the Icahn School of Medicine at Mount Sinai. His innovative work in AI has won multiple awards, including the Grand Challenges Award from the Bill and Melinda Gates Foundation. Before I hand it over to you, Dr. James, I would like to also remind you that if you have any questions during the presentation, please type them in the questions box in the control panel. At the end of the presentation, there will be a Q&A session to answer some of these questions, inshallah. I'm pretty sure I'll be managing a flow of good questions from the audience, and I will surely have questions of my own relevant to the topic. And if I'm really lucky, I'll be able to sneak in a few Lakers questions, Dr. James, because I know you and your family are huge Lakers fans.
Yes.
Dr. James, thank you once again for your time, and I hand it over to you.
Thank you. بسم الله الرحمن الرحيم. السلام عليكم. يشرفني نكون هنا معكم اليوم، وأتأسف كنت أتمنى أتكلم بالعربية لهذه المحاضرة، لكن أسفاً عربيتي ضعيفة فيجب أن أتكلم بالإنجليزية. So I'm very excited to be here. Today I'm going to spend a bulk of the time discussing how to build powerful AI applications, especially in the face of the health crisis that we have today. And my hope is for the attendees to leave the meeting with a sense of empowerment about how to build these applications, a sense of initiative to maybe go back to their respective organizations and start pushing for AI applications moving forward, and also a sense of optimism that there is a lot that we can do with the right determination, with the right focus, and the type of determination and focus that Dubai and its people have shown the world for many decades. So without further ado, let's see. Very good. So as my brother Khalid mentioned, I'm the founder of WSDM.AI, where I help organizations deploy useful and powerful AI applications. Prior to that, I was a professor at Stanford University in the United States. And before then, I founded the Arnhold Institute for Global Health at Mount Sinai, which is the largest private health system in New York City. As you can see, I'm a father of 4 children. In fact, my youngest is turning 1 on Friday, inshallah. So to get us started, I want to use an example of a previous health crisis that happened 4 or 5 years ago now. But as many of you remember, back in 2014 or so, there was the Ebola crisis. Shortly after that, there was the Zika crisis, which didn't garner a lot of attention, primarily because it didn't affect the US and Europe. And usually when those areas get affected, then, you know, it becomes newsworthy. However, you know, Zika had a terrible, terrible effect on Latin American countries, specifically Brazil. And for background, what Zika is a mosquito-borne disease that affects especially pregnant women and causes sometimes deformation in the children that are born from the parents who have contracted, the mothers who have contracted Zika. So there was one case that happened in 2016 in Miami. And as soon as the first case, there were 2 cases that were discovered. 2 areas in Miami, about 5 kilometers in perimeter, were locked out. These are the grayed out areas here. You see Miami Beach on the right, the little island on the right, there's that maybe 5-block rectangle on the left. And basically with pinpoint precision, the Department of Health in Miami quarantined those areas. They knew that somebody was there. They knew that they had Zika. It could be transmitted to other patients, to other people. So they quarantined those areas. A very tight, about 5 kilometers wide area. So it's a very tight confined area. Now let's take that in contrast with another break, for example, when we had the yellow flu or Ebola, right? Where entire nations are quarantined, right? Anything, you know, more granular than that is just not feasible because mainly the data is not there and the infrastructure is not there. So if you were to look at these side by side, these are the same zoom level. You actually can't even see it, but if you kind of squint your eyes, I'm not sure if you can see my mouse cursor, but right here to the right of Miami, that's the area that I was showing you. These are the same zoom level for both. So as you can see, it is a minuscule, very targeted area in the case of the United States, but it's a massive, massive area in other areas where if you are not prepared. Now, COVID-19 has shown us that for us to have sort of really state-of-the-art, advanced sort of crisis monitoring systems, data systems that are really resilient to crises, it's not enough just to have precision, but there's other things that we need to handle, because in this particular case in Miami, the health system was not overwhelmed, right? The data was pretty clear. They knew who the people were. So it was much easier to handle compared to COVID-19, where people come under the radar. They are asymptomatic. You can't tell that they have a disease for up to 2 weeks, and other sort of issues with the data that make it very hard to contain. So how can AI help us, and big data, help us prepare for these kinds of catastrophes? Because they are going to continue to happen. Global climate change, these pandemics, these are going to be almost a new normal until we build resilient systems to contain them quickly, that we stop them before they become a pandemic. So the first thing that I wanted to just highlight quickly is what is artificial intelligence. So at a high level, artificial intelligence is a set of algorithms that improve through experience. And here what we mean by experience means really more data. So an algorithm gets better and better at a task as it observes more and more data. And here's one example of this. So what you're seeing here is what's called a deep neural network. And what the algorithm tries to do, it takes the picture on the left here, the big square that you see, and it goes through this pipeline that you see here of analysis, and then it tries to tell you what is inside that image. So look at this image on the left, it says this is a ship. This one that says it's a dog. The next one, it's a ship again, maybe, but even though it's closely related to an airplane. And as you can see, sometimes it does well, sometimes it doesn't do well, right? And actually, you could go to that. This is from a course at Stanford University. This is running in the browser right now. So actually, it is getting better and better. This video I took many years ago, and now actually, if you look at the algorithm live on the Stanford website, it does actually very well, because here it's doing quite a few mistakes. But the idea of artificial intelligence in general, in a nutshell, is that it needs a lot of data in this form, where you have for example, if you're doing this image and trying to figure out what's inside the image, it needs a large set of examples where you give it the image and you tell it explicitly what's in the image. So maybe you'll have 1 million pictures of cats, and each one of them says cat, 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 cat. So the algorithm then takes these images and tries to understand, right, what about this image makes it into a cat? What about this image makes it into a dog? What about this image makes it into a horse, et cetera, right? And there's powerful applications. So the self-driving cars, for example, that Tesla has and others, is powered by these deep neural networks. So this is something that is actually quite difficult technologically and has real-world applications in a lot of domains. So, and this is great. So that neural network that I showed you, and when we think about AI, we usually think about these very cool applications and the innovations. And they're very difficult. You have probably multiple PhDs working on this, hundreds of thousands of dollars in development and research and development that are going in every year to build these products. But to make a useful large-scale application, the technical innovation is only a small piece of the pie. And that gets lost. Like anybody who thinks about an AI project is always thinking about, how do I write the algorithms? Where am I going to find the data scientists? Where am I going to find the data? Usually, like those are probably the three questions that people spend most of their energies on. And even if you were to answer them correctly and perfectly, you're not even close to the finish line in terms of deploying something that could stop a catastrophe like COVID, or maybe to monitor national security, or to help a hospital in a large urban city. So I wanted to show you this as an example. So as I mentioned before, I spent a lot of time in healthcare, and one of the biggest problems is that a lot of these for example, COVID, there has been now an AI application that analyzes the X-rays of patients and is able to detect small deformations in the image that usually signal that that patient may be positive for COVID. Okay, very interesting algorithm, very cool stuff. A bunch of computer scientists developed it using, publicly available radiology images. See, the problem is that for most applications, not only have to do something that's useful, but you also have to fit in the context of your user. So what this shows, this is a smaller map that one of my team members had built for me, a product manager, that shows you the workflow of a primary care physician in the United States. As you can see, it is very complex. And doctors in the United States have very high rates of burnout. They don't want to hear about you making them do something else. So when we invent a new AI tool, as a data scientist, you are not necessarily thinking about how is it going to be used in the field. So with this particular physician, there are only maybe 1 or 2 opportunities where you could seamlessly inject the artificial intelligence component in their existing workflow for it to be successful. Because if you're going to ask them, Dr. So-and-so, I've made this amazing application, right? But what you have to do is you have to stop what you're doing. You have to open a laptop, fire another application, click a bunch of things, wait for the answer. It's just not going to happen. Nobody's going to do that. Just to keep going with the analogy of the Tesla example, Tesla has self-driving capabilities. And when you're driving, you could keep your eyes on the road. You just press a button and it goes into self-driving mode, right? But so it fits into my context as a driver. I don't have to take my eyes off the, I don't have to take my hands off the wheel. I don't have to take my eyes off the road, right? So within my context as a user, this AI capability of self-driving fits perfectly. What if it told me I had to go and tap into a screen or use a laptop or do some other type of code or pull over and, activate self-driving and then do it again? Like, it's just not going to stick. So it's really fundamental to understand that algorithmic innovation is only a small part in the AI journey. And this is the reality. The hard reality is this. If you are thinking about building AI, you have to start from the user's pain first. If you do not start from the user's pain, the best you will do is have an academic publication that dies in the PDF. And that will be a missed opportunity, especially in this time and age where there's so much appetite for world-changing AI, but so few actually powerful applications out there. So there is a true disruption opportunity in front of us today. And so what do we need to make value-adding AI? Usually there are 4 components really that distinguish between academic AI, like these neural networks that I showed you, and then actually a real-world useful AI application. And that's data, meaning what's the quality of the data that you have? Domain, is it usable? Meaning, do you understand the context of a user? Is it solving a real problem in that domain of the user? Decisions, and here basically, can people act on the output of your algorithm, right? If your algorithm says that this is a 90% chance that this is a cat in this picture, does the end user know what to do next? Is there a path to taking another action, right? And that's what the so what chasm means. And then finally, are you demonstrating value? Because a lot of academic AI, the way something is deemed useful is very different than the real world. In academic AI, where most of the innovation is happening, what you have to do is you create a new method that's just better than another benchmark method. So you'll have a method that is doing the image, the object identification task that I showed you earlier, and maybe it's 90% accurate. What you have to do is propose a new method that's 91% accurate, and you will get published. You will say, look, I am better than this old method, therefore I am the state of the art, but that's it. However, in the real world, you have to show not only the novelty is not as important, because in academia, you want to show that something is new and better. In the real world, you want to show that something is just valuable. Like, I don't care if it's new or not, but what I care about, is it valuable? Does it solve my problem and makes my life better? Does it save me money? Does it make me faster? Does it make me more efficient, et cetera, et cetera? So I wanted to spend some time on the data component, which is, from my experience, the biggest gap that we see today, especially in the age of big data. So always the very basic assumption that you should have anytime you are thinking about a data science or an AI application is that the data is bad. Always, you're going to meet many stakeholders in every single conversation that I've had in my career. Somebody would tell me, we have amazing data. We just need data scientists. We have amazing data. All we need is somebody to analyze it. You go and you look at the data and it is completely useless. And especially people nowadays, in the last 5 to 10 years, people conflate data quantity with data quality. So they'll have big data, as in a large quantity of data, but it's very poor data. So it is not actually helpful. It is actually more helpful to have a smaller data set that's very well curated, as opposed to, and in fact, those are the types of data set that most of these AI models are built upon, as opposed to this very large but messy data set. So it is very important to come in with the expectation that the data is poor. And as part of this project, if you are a data scientist or a project manager or a stakeholder, you have to account immediately that I am going to have to collect my data to solve the problem that I'm trying to solve. This is a problem in AI today, because most of us just download a data set from the internet and start doing work. And that was very useful like 10 years ago when we were trying to learn AI, when AI was trying to enter the mainstream, but now it doesn't cut it anymore, because when you download a data set from the internet, you lack what's called data empathy. You just don't understand, why was it created, who created it, for what purpose. Like, we're just trying to throw some algorithms at it, and that does not solve the problem. So just because data are big, it doesn't mean they are useful. So what really needs to happen for us to have very powerful monitoring systems, and this is why, in fact, on the other hand, there isn't much AI can do today to address COVID directly. Yes, there are many things that we can do with AI to address the consequences of COVID, but and to respond to COVID in different industries and different areas of life, but to specifically address COVID, it cannot be done, mainly because of the data. And that's because to have a very powerful sort of monitoring system, especially to monitor crises, to be able to act on useful data, the first thing, the data has to be timely. That is, that as data are coming in, I can act on it right away. For instance, you don't want to get a data point a month later if you're trying to act within a few hours or a few minutes, right? So it has to be timely. It has to be accurate. Are you actually measuring what you intend to measure? You would be surprised at how many times you are writing an algorithm to analyze a data set that you assume is doing something, but actually, in fact, it is not, especially data that you didn't collect yourself. So is it actually measuring what you want to measure, right? So for example, in this case, maybe it is it measuring the temperatures of patients, right? So I want to monitor if, on average, people tend to have higher elevated temperatures for some reason. And then, is it representative? This is the biggest danger. What I mean by is it representative, that is, when we collect data, most of the time, especially if you inherit it, it's very likely that it's biased. What I mean by biased is, in the example of the object recognition problem that I listed earlier, for the algorithm to work very well, it has to see a lot of examples, a lot of variety of examples. It has to see dogs, it has to see cats, it has to see birds, it has to see cars, it has to see airplanes, right? So for example, if I train the model, if only the examples that I give it are of cats, right? When I show it a dog example, it won't be able to answer it. Like these algorithms cannot reason. What they're doing, they're just mapping the inputs to the outputs. They're mapping the picture to the word dog or cat or mouse or whatever. So if I train the model only on images of cats, once I show it an image of a dog and ask it, what is this image of? It will automatically tell me cat, because that's the only thing it knows what to say. So that's what I mean by, is it representative? Is it really showing you the full spectrum of possibilities in your problem at hand? And finally, is it relevant? This is very dangerous, especially for legacy data. So if you go into a governmental agency that maybe has been collecting data for many, many years, or a healthcare system, for instance, I worked at a healthcare system that had built a data center for 10 years. 10 years they've been collecting data. I think at their peak, they had 400 FTEs, 400 full-time employees managing this data center, right? But actually the data was useless, meaning it was not relevant to the machine learning application that we were trying to do. A lot of times, I would say probably 9 times out of 10, what you are trying to predict is not related to the data that you have. And therefore, no matter how much data you have, if it is not related to what you're trying to do, then it just cannot be done. So these are the 4 things that, this is the first investment that anyone that's working either in government or in the private sector needs to think about, and it has to be an investment that's done today. If you want to respond to COVID, 2022, whatever that version of it is going to be, we need to start making the data investments now. We have to have the foresight now to make those data investments, because if we wait until the new COVID hits, or the new Ebola hits, or the new hurricane hits, it is too late, because these things take a lot of time and resources and infrastructure to build. But this is the 4 pillars of actionable data that can be fed into high-performing AI algorithms: timely, accurate, representative, and relevant. So I wanted to show you an example, another healthcare example. So this is from colleagues at Stanford University, where they built an algorithm that has, as you can see, a camera, and is basically detecting people, whether they wash their hands or not. Are they sanitizing their hands or not? And this sounds like an amazing application for COVID. One of the ways COVID spreads is when people don't wash their hands and they touch their faces or touch other people, touch metals, etc. So what this algorithm tries to do, just looks at the video, it tries to figure out, did you sanitize your hands or not? So this person did, this person didn't, this person did, and et cetera, et cetera. So this sounds like a perfect application for COVID. We should install it in all hospitals. We should monitor everybody if they're washing their hands, and we can do something about it. Except that it's not a great application. And why is that? So let us think about the 4 things that I mentioned before. Let's go back and just show them again. These 4 things: data, domain, decisions, and demonstrate value. Let's go with the first one, data. Are they collecting their own data? Are they assuming that any existing data is poor? Yes, they are. They are collecting this data in real time, watching those people, in the video feeds and training their algorithm with that. So that's check, that's great. Domain, is it usable? To some extent, it is, right? Like they installed this camera. Technically speaking, most hospitals don't have these cameras, but actually these cameras violate patient privacy. So they will have to use some other type of sensing that doesn't show people, but you could use, for example, depth sensing or other technologies that are actually relatively cheap. But you have to install these sensors. But they clearly worked with hospital people, and they clearly thought about this problem, in conjunction with the hospital staff. So the domain is there. So now decisions, and this is the important one. So what? So your algorithm tells me whether somebody has washed their hands or not, sanitized their hands or not. So what? What do I do now? This is where this application fails, in the sense that once I detect that James did not wash his hands, what does that mean? What do I do? Do I sound an alarm? Do I quarantine him? Do I just keep a track of that? Just count, 1 person didn't wash their hands? What do I do? The decision maker is not given any sort of intelligence in that regard. What do I do once this algorithm detects somebody who didn't wash their hands? That's what the so what. So what? You detect people that don't wash their hands. So what? What do I do with that, right? Like as a physician or as a hospital administrator, this application does not give you really any action to take once this happens. And finally, do you demonstrate value? This is, again, I'll say a no, because really to demonstrate value in the healthcare domain, for them to adopt, right, to get to that adoption, One piece of the component is, do you fit in the user's workflow? And that was that diagram that I showed you of the physician. Is it easy for people to use it seamlessly in their existing workflow? They don't have to learn anything new. They don't have to stop what they're doing. That's one part. The other part is it useful? Can you prove that me doing this extra step actually brings value? And usually in healthcare systems, people have to use what's called randomized controlled trials, where basically I do two alternate realities. One reality where I am using the AI technology, one reality where I'm not using the AI technology, and I monitor some metrics that I'm interested in, and I will see that if the people that use the AI algorithm are doing something stronger, bigger, better, whatever it is, right? That's also known as A/B testing in the internet scene, but it's the same idea. So although that sounded like a very cool AI application, in the real world, it does not gain traction, and it was not used during this COVID, although it's an existing technology that existed, I would say, at least 4 or 5 years ago, right? So that's one example. So let's look at another example. So another problem that we have is water shortage, right? So what you see here on the left is an area in the Baltic Sea where between 2000 and 2014, you can see that this water dam just collapsed, like pretty much dried up completely, up to maybe 80, 85%. On the right, this is near the Nepal, where you see between 1984 and 2011, a glacier melted and created this massive water body. So we have both of these issues that are contributing to the water crisis. We have massively shrinking water bodies, and we have also expanding water bodies, mostly due to global climate change and pollution. I'm not going to talk about the technical aspects, but this was done by my former PhD student, Shi Chen, who's now a data scientist at Facebook AI. But you can look at the technical AI component in this paper that I cite below if you want to look at the details. But at a high level, what we try to do is to leverage Earth orbiting satellite data to identify all water bodies around the globe and then monitor their size over time. Are they growing? Are they shrinking? Okay. Sounds, like a cool idea, but it's actually quite difficult to do. So what you see here is the left panel is what the satellite image looks like. But this red means that data is missing, or there's cloud coverage. So at any given time, the image is not pristine where it's easy, let me just look for blue color, and that would be the ocean. No. And here you see it more the way the computer would see it, or the algorithm will see it. And this is actually what we would want. And if the algorithm were to do it in a naive way, as you can see, like the body of the lake is just going crazy. This is not accurate. What we want is the rightmost panel here. As you can see, this is more smooth. This is the realistic changes in the water body size and contour. And so we built this algorithm and we deployed it globally to monitor all water bodies. And what we found was something very interesting. There was this dam. So this work was done in 2014. This is the largest dam in Brazil out of Sao Paulo, one of the most densely populated cities in the world. And this was right around the World Cup, the Soccer World Cup, 2014. So as you can see, I'll just pause it here for a second. What you see here, basically, this blue line is just precipitation, rainfall in this area, average rainfall in this area over, a certain time period. The green curve here is our estimated area of this water body, right? So with this dam, we're looking at it. And as you can see, from 2010 till 2012, the size of the water body, is shrinking and growing, but it's pretty stable. It's pretty flat. But let's pay attention now what happens to this green curve around 2013, 2014. Watch this. All of a sudden, there's this massive acceleration of shrinkage, and you're going to see it now here. You're going to start seeing some brown pixels where water is supposed to be. That's just like aggressively drying up. July 2013, going into 2014, and pretty much this isn't the news. You could go and look at Time Magazine and other articles writing about this massive Brazil drought of 2014, where this water dam that contributed to one of the most densely populated cities in the world collapsed completely, right? And we detected it around July 2013, a little bit before, like between January and July 2013. So we reached out to the Brazilian government, and in fact, they took us so seriously, they sent a contingency of scientists to Minnesota, USA, in the winter, when it's very, very, like minus 20 degrees Celsius, very cold weather, to come and work with us on this when they found out about this technology. Unfortunately, they couldn't act upon it because it took us a while. But again, so in our case, the data was not timely, right? Our data was coming in from satellite imagery that has significant delays. Maybe like, years later, we analyze these data sets. So in our case, we couldn't build a very useful system for that particular purpose because the data was not timely. But then we launched this global tool, and it's available here if you go to this umn.edu website. But now you can basically monitor all water bodies in the globe. So here I'm just showing you all the large water bodies in South America. And here are the ones that are growing and shrinking. Orange means that it shrunk over time. Blue means that it grew over time. As you can see, there's more orange than blue, but you could go and click on any of these water bodies, zoom in, you can look at the satellite imagery and actually inspect the water body. But when you click on any one of them, it gives you this time series here at the bottom that shows you the trend. As you can, I think I'm gonna scroll down in a second here. But basically, as you can see, there's a downward trend. That thick curve here, let me just pause this. This thick curve is showing a consistent downward trend over time, that this thing is consistently collapsing, and in fact, now it's pretty much stabilized at this lower level here. And you could play this at your own leisure when you get a chance. But now we built this global tool. I was not actually involved in building this part of the tool. We built the algorithms, and I moved on, and some of my former students did this work. I want to show you one last example. And this is another example where this is in Liberia, where people deliver healthcare using these kinds of maps. This is a healthcare workers map of the region. And there are many, many difficulties of delivering healthcare in a timely manner, especially if you have Ebola or any sort of infectious disease. And as you can see, roads don't have addresses here. So usually you would say, I have to visit, Chris, who lives by the church, or I have to visit Diane by the school or by the river, etc. And this is what this health worker does. She goes and walks around this area, which is about 2 to 3 kilometers wide, by foot, and has to visit all these houses that she has marked to provide services for them. But this is very slow. There's no real-time data involved. There is no other contextual information is missing here. All I know is like where people live, but what about other things? Like, for example, do they have access to water? Do they have access to food? Et cetera, et cetera. So what we did, we built this application in conjunction with the user by spending a lot of time in the field, and we produced this application that won the award that Khalid mentioned from the Gates Foundation. So here I'm logging into the application. And sorry, this is in Spanish because we deployed it in Guatemala. So here, for example, we are looking at different demographics. So what you see here, the problem here, I guess, to relate it to COVID, these heart pins here are what's called health posts. Each health post has 1 or 2 nurses, and each nurse has to visit an area about 5 kilometers to 10 kilometers wide. So it's one nurse for about 5,000 people. So prioritizing who do you see first is the top most difficult problem that these health workers face. And this is the same exact problem that many hospitals in the world, maybe not in Dubai, but many hospitals in the world face. When somebody came with fever, did you prioritize them or not? What did they use? They used a very silly heuristic. They asked 3 questions. Did you go to China? Did you go to Italy? And do you have a high fever, right? If you did not answer yes to these 3, or 2 of the 3 at least, you will not be admitted to the hospital at first. And that was one of the reasons why it spread so badly in places like New York, because when the patient was turned away and they were actually COVID positive, now they went in the subway, they went in the bus, and they infected another 100 people on their way home. So the idea is here, how do you prioritize beyond these silly metrics? What can a computer do to help me prioritize instead? So here we built an AI application that leverages multiple sources of data besides like 3 questions like humans do, because computers can do that, can handle lots of information, to combine them together to give me a better sense of risk and who should I prioritize, which patient should I visit first to make sure they are taken care of. And so what this does, it shows us, for example, you can look at different, you could search, you could look at different populations, mothers, children under the age of 2, infants, et cetera, and it tells you there the total number in the catchment area. This is the catchment area for each health post. This is just a heat map. That was just a demo. So now if you zoom in to a certain village, so this is one health post, and here's the village, and here's what it serves, and here are where the patients live. These house icons are where the patients live. And this one was red because it was at risk. And basically what we did, we combined multiple sources of data to say, this is the household you should visit immediately. Let's see if it's going to zoom in. So there we go. So now here's the information that we use to determine that this is a high-risk household. We analyze satellite data to find these fields. So you can see here the crops that are being near that house. It also looks for water bodies, although I guess there were no water bodies here. It uses other crowdsourced information like schools, hospital, churches, religious institutions, etc. And combined with all that data, also environmental data, as you can see here, temperatures, because we were looking at Zika back then, so temperature and humidity is very important. And then we combine that with health data that comes from mobile phones. So when the health worker goes and visits the patient, she enters some mobile phone data and she sends it back to the cloud to us to analyze it and add it in there. So we said this is the person that needs attention the most. As you can see, that's temperature, humidity, crops, crop yields, etc. So basically, you know, that's the idea there. Combining multiple sources of information to prioritize care better than if you were to do it by, you know, manually by a human. So what's common about these applications? I know I kind of ran through them because I want to give more time for Q&A. Is when you're thinking about an AI building, so the first thing, as I mentioned, is that we have to invest in data. There is nothing we can do without data. So that's a significant upfront investment that has to be done, and leadership has to be committed to collecting high quality, actionable, timely, and representative data. But now when we think about an AI life cycle of an application, AI is not like software engineering. See, a lot of people compare the two, and you know, we've been developing software since the 1950s. So we have 70 plus years of experience developing software applications. AI, on the other hand, especially at this scale, has only started being deployed in the last 10 years, maybe at most. So there's a lot of uncertainty around how to do this, and people don't understand it as well as software development. So, but this is at a high level, my characterization of the life cycle of an AI project. First, we have to start with a problem. As I mentioned before, if you don't have a valuable problem, it is not going to get adopted. Second is the data, and you have to get your data scientists to be as close to the data generation process as possible. Ideally, you are producing your own data. Then 3 is the modeling, and that's where most people focus, right? That's where, as I mentioned before, that's where everybody sort of pays attention to. Where are the data scientists? What are the algorithms? What method I'm going to use? Neural networks, decision trees, all these jargon words, right? But that's probably only 20% of this entire pipeline. Then there's deployment, where you take a model that was developed by a scientist and turn that code into usable, scalable software, right? Like the software that works within an existing infrastructure. So for example, if you have something like Dubai Passport Authority, maybe a scientist will build an application that mines the pictures of the passports and does something to it. But now you have to go and take that idea and inject it into the software that's analyzing the passport's data, that scans the passport. So they have to have software engineering involved. And then there's monitoring, meaning that there is a problem in AI called model drifting, where a model's performance slowly over time is going to degrade because it was trained on old data. Now new data are coming in and things are changing. Maybe now there are more, maybe opened, you know, your borders to some country. So now you have more people coming from that country that you didn't have prior. So now the model is not doing as well. So you need to retrain the model. You have to continuously monitor the performance of the model in real time and then decide to retrain it when needed. Let me give you an example. Google PageRank, which is like the bread and butter of Google, is updated every single day, pretty much daily. That's how much attention is given to the monitoring. It's a significant cost. And then finally, maintenance, right? So over time, you want to make sure that the model is working well, that it is compatible. Maybe now there's new software that you're using, so you have to make sure that it's compatible with it, et cetera. So when you think about not only the cost in terms of personnel, but also the cost in terms of money, you have to plan properly for this realistic life cycle. What most people do, they're stuck on number 3. On the models, they budget both in terms of personnel and finances and time with the models, and that usually leads them just to very inefficient projects. And so why is AI not everywhere? Like AI sounds like a very revolutionary tool. Everybody has data. We have lots of problems in the world, many of it related to, you know, the crisis that we're facing right now. But why don't they take off? And usually these are the 5 reasons that I've seen across now dozens and dozens of companies that I've advised and worked with. The first one is what I call AI by press release, meaning that people choose to do the coolest sounding project as opposed to the most useful project. That is, before they even start working on anything, they write a press release and send it to the media so they could get attention when they haven't even done a single line of code. They haven't written anything yet. So choose a project that is relevant and important, not cool sounding. That's number one. So anytime I go into a team and audit it, if I hear a lot of data scientists said, oh, I want to work on an interesting project, that's a red flag for me. Interesting intellectually is not the same as valuable from a business standpoint, and we have to differentiate between these two. So that's the first one. The second one, I mentioned it before, is the lack of value, or these applications do not cross what's called the so what chasm. What I mean by that is a lot of AI applications, you have a very smart person, and she would say, I heard about this new AI tool, this new AI algorithm. I wonder what happens if I apply it to this problem, to this data set that I have, right? And we already know what's going to happen, nothing, because it wasn't a well thought out design. Like it just said, there's this hammer and I'm looking for a nail. It is not really a thoughtful solution. So that's why when you take it to the domain scientist or the domain user, they'll tell you, okay, like you applied this algorithm to this data set. What does it have to do with me? You never spoke with me. You never solved my problem. So what? So that's why some AI projects fail. The third one is poor fit. This one is very important in the sense that we have to choose problems that fit what AI can do. AI is mostly focused on what's called predictive modeling. Given a set of examples, right? When I give you a new data point that does not have a label, you can predict what that label is. That's called a predictive problem. So for example, given a lot of data, maybe, and then telling me this person is infected, this person is not infected, this person is infected, this person is infected, you give me a new person with some vitals, and I can tell you what the likelihood that that person is infected. That's a probabilistic prediction problem. What most people are interested, though, is not a predictive model, it's what's called a causal model. It will be something like this. A question such as, will this patient get better if I give it drug A or drug B? That's a causal problem. See, that is not a predictive problem, because I'm saying, if I give it A, would it get better? Or if I give it B, right? And the reason why that can't be solved with predictive modeling, because for example, if I gave it A and that person got worse, we don't know if they will have gotten worse if we didn't give them the medicine, for instance, right? So that's where these algorithms cannot perform well. Or for example, in the case of the government, they might say, which businesses should I close to minimize the spread of COVID while minimizing also economic impact? That's something that AI can't answer. That's something where you have to go to what's called causal inference. And it is part of AI, but it's not mainstream. It's not something that you could find easily. It's not something that comes cheap. And it's definitely not something they could develop quickly. The fourth one is inappropriate investment, which I just mentioned before. People usually misunderstand and underestimate how much time and money and effort it takes to deploy an AI application. And most of the time what happens is, people kill projects too soon as well. So like they work on it a while. Yes.
Dr. James, I'm sorry to cut you, but
yes.
I'm getting hammered with questions, so you've got only 2 minutes.
This is the last slide, so we're done.
Okay.
So there's this inappropriate investment that we just, like when we commit to a project, you have to see it all the way through. Otherwise, like you're just killing your project too soon. And finally, as I mentioned before, is it actionable? Can we actually act on this project in a way that makes sense? For example, maybe your project is telling the government to shut down all flights into the country. Well, that's not an actionable thing to do, right? So we have to balance what's maybe feasible will have been a better word, feasible solution with the algorithmic performance, because the algorithm does not know what's feasible and what's not feasible. You have to have a stakeholder in the room. Sorry, the last slide is really this. It's about how do you get started with your own AI project leaving today? If today this talk inspired you, and I hope it did, and gave you optimism about what we can do with AI if done right, here's how it starts. First and foremost, you have to educate leadership on what I mentioned, the cycle of AI, what AI does and what AI doesn't do. That is not a magic wand. It's actually a research and development investment, right? Start with a small pilot project. Don't do AI by PR. Just simply start with something very simple. Can I save my team 5 hours a week? Can I save $200 a week? Something very small, but very measurable. And then you want to measure everything. Measure the performance, measure the data, measure everything so that you can report and learn from that and continuously improve your algorithm as you go along. That's the beauty of AI, is that it learns as it goes. As with more experience, it gets better. Then you have to manage stakeholders. You have to bring in all these different people that are going to be your users, that are going to be your funders, and you have to do a good job managing them. It's not just a technical job. And then finally, as I mentioned, you want to demonstrate value. Whatever value, even if it's small, just communicate that and build on the small wins. Don't go for something too big, for what's called, what we call in baseball, the home run. Just focus on small, simple, actionable benefits to your company, to your division, to your government agency. And with that, thank you very much. Happy birthday to my son. He's turning 1 on Friday. So happy birthday to him. And I'm ready for questions, Khalid.
Happy birthday to your son, and hopefully, inshallah, we get to see him soon, inshallah. Okay, thank you very much, Dr. James. I cannot thank you enough for such a joyful and engaging presentation, and I'm sure the audience has enjoyed it as much as I did.
Thank you.
To kind of relate to the topic of today, this is a little bit out of topic. I kind of been reading a lot about reskilling, and this has been a hot topic for the past few weeks. And it is a challenge by itself. And I think there would be, listening to your presentation today, there would be a direct relation or correlation between AI, data science, and reskilling. And I think governments will be putting reskilling as one of their major objectives in the near future. Now to move on to the Q&A. MashaAllah, I just realized that we have more than 500 attendees for this webinar, MashaAllah.
Wow.
I hope you're ready for some questions coming our way, Doctor.
Take it easy on me.
Okay, I'm gonna have a look at the questions, and okay. There's a question from Sarah. I think she mentions the first question she talks about. I think you've answered it already. She says, how can we use data in the day-to-day decisions in organizations to improve performance, efficiency, and effectiveness? And I think you've answered that already. Yes. Do we need data scientists in every organization, department, or team? And are there certain skills or tools that can be used to develop those kind of managers or scientists, people on the business side of the business with data relevant skills? So do they need to develop them?
Yes, you need to have data savvy team members. The title can vary: data analyst, data scientist, research scientist, it doesn't matter. But you have to have data savvy people on your team to be able to caution against especially the pitfalls and to be able to help you focus. And usually you could have a data savvy manager, right, who just understands at a high level. That's what I mean by educate leadership. Somebody who could just understand what machine learning and data science and AI is and isn't. And their job is really to do one thing. And this is very important. I see so many people working very, very, very hard at the wrong problem. And that's the job of a leader, of a manager, is to just steer the team to work on the right problem. And then you could have analysts, business analysts, data scientists that can do the analysis, but once you point them in the right direction. So that's usually the job of a leader. And the leader has to be nuanced when it comes to data science and AI. But yes, definitely any organization that has data savvy people will benefit if they have the right support. Many times data scientists will go into an organization and maybe the first data scientist joins by herself or by himself, and they're completely isolated. Nobody values them. Nobody understands their value. And guess what happens? They go work for Google. They go work for Apple. They go work for Facebook, as opposed to working for the government, where they could be tremendous assets if valued and used appropriately.
Yeah, makes sense. Okay, I'll try to get in as many questions as I can. There's a question from Aham. He says, does the algorithms are they really responsible for decision making? I think this is people, or is it people or managers' responsibility? He's just asking about algorithms.
Correct. So yeah. So basically, the problem is that humans are very bad decision makers. I know it sounds bad, but it is true. There's study upon study in psychology. People won Nobel Prizes about all the decision biases that we make. We always overestimate how good we are at making decisions. So technically speaking, where you want to use AI is to augment your decision making as a manager, as a decision maker. Really is to do that. Really, for example, eliminate irrelevant information, highlight most important information that I need to know to make the decision. That's really what it is. But what I mean by closing the what chasm, meaning that I need to surface the right information for you so you can make the decision. If you are making a decision without taking into consideration anything the algorithm is putting out in front of you, then the algorithm has failed. The project has failed. So that's what I mean by that. Yes, it's ultimately a human decision, but algorithms can make it much, much better. Let me give you an example. There's a company in the USA called Stitch Fix, and they recently IPO'd. They became a public company, which is a great sort of success metric for startups. And what they do, they send you a box with clothes. Every month they send you a box with like 5 items or something like that, right? And what the algorithm does is sifts through thousands and thousands and thousands of items, and based on your profile, will recommend a few. But usually what it does, it sends them, they don't just put them in the box and send them to you. It sends them to a human stylist to give it a little more of a human touch. See, but the stylists on their own, they wouldn't have been able to do that without the algorithm first winding it down to 5 items, and then the human adds the final touch.
Yeah, makes sense. I've got another question here from Ahmed. I hope I can get the question right, if I understand properly. In your point of view, which AI application, tailor-made or our own developed app? I'm not sure what he means exactly. Do you get the question?
I get it. So I think, yeah. So basically, there are 2 types of AI that can be applied today, 2 or 3. One of them is what I call off-the-shelf AI, meaning you learn about an application. Maybe you read the paper that I showed you in this presentation. You take it, you download the code, and you just run the code on your data. That's off-the-shelf, meaning that you don't need to understand the inner workings of the algorithm, and it may or may not address your needs perfectly because your data might be unique, your problem might be unique, but you're going to use it off the shelf. And there are many, many libraries that do that. There's another end, which is where you develop your own tailored algorithms, like we did for this water monitoring project. No existing algorithm could have done it, and that's why we published this new algorithm to do it. So, but that one is very much research heavy, takes a really long time. So yes, ideally, your own solution is the best, but it's not always feasible because maybe you need to get something quick. It might be expensive, you might not have the talent, et cetera, et cetera. So I think those are the 2 options that you have to choose, really, is off the shelf or tailor-made. And I think that you know, the short answer is it depends on what you're trying to accomplish.
Okay, we'll move on to the next question from Sarah. Getting to a stage where data is big enough in certain contexts, such as COVID-19, can be costly. Do you think small data, Bayesian as opposed to frequentist, can be used to predict, prevent, contain a situation or crisis? Yes.
That basically the big debate, and I might have a paper on this, big data versus small data. And I believe that small data can do the job. Unfortunately, the majority of people have been developing methods for big data only. And as a result, small data has been neglected as a research topic, as professional career, et cetera, et cetera. But definitely, small data is better here because we can't sit and wait for us to have gigabytes and gigabytes of data. We have to act now. So we definitely have to use Bayesian methods to do these things. There are pitfalls to those methods, of course, like there's no silver bullet, but for sure they're a worthy area of exploration and definitely a worthy tool to leverage, and especially when you're short on data.
Okay. Okay, now speaking about COVID-19, Imran saying, wouldn't it be helpful to acquire the pictures of healthy people prior to having COVID and after getting infected, or anyone or any eye recognition? What might be the issue or difficulty?
There are a few difficulties there. So yes, so this goes back to building the data infrastructure and collecting the data in advance. So maybe right now, all you're collecting is some sort of data. I don't know if it's a picture or something else, but collecting it in advance, right? And you just have a database of data before this incident happened. And now you're getting data when the incident happened, and now you can build a model that discriminates between the 2. The challenges is, number 1 is like, do you have the infrastructure to collect the data and the initiative to collect the data? It is not easy or cheap to go and collect any kind of image of anyone just randomly, like without some sort of strategy. Number 2, there are privacy concerns, right? So obviously here we're trying to use it for health, but a malicious actor could go and use it for something else. So we have to always be wary about just massive blind data collection. That's what happened with the Facebook scandal a couple of years ago with Cambridge Analytica, where you were playing Farmville on Facebook, but then it was collecting all this information that was completely irrelevant to you playing the game. And then people exploited that, right? So there's a privacy issue there. So really those are the two ones, foresight and investment, and privacy concerns are probably the top issues. There might be some specific issues for each application, but those are the two top level ones.
Okay, perfect. Another question here from Mohammed. Do you recommend open source software AI for government or not?
Yes. Open source software is actually very good for government. Even the US military uses it. As in, you could clone the open source software and then do what you want to do with it. The reason why open source software is very powerful is because any vulnerability that might be introduced in the software is going to be fixed by the community. If you have proprietary software, then you don't know if it's going to be patched or not. Like, it's just like, it depends on the developer. But open source, always you have thousands, especially well-maintained packages. They have thousands and thousands of contributors that they catch a lot of security flaws, a lot of bugs. So like basically you have a distributed team of thousands of free workers that you could leverage. So for sure you want to leverage open source. And in fact, all major companies in the world rely heavily on open source.
Thank you. Okay, we've got another question here from Suleiman. The human bias in applying AI applications is a challenge. How can we overcome such a major challenge?
Well, you either have to remove humans from the decision making because they are very biased, which is difficult to do, but at least there are now tools to measure certain types of bias. So there's an entire field, it's very nascent, it's called FAT, F-A-T, fairness, accountability, and transparency. So if you type machine learning FAT, you can read about it. There's a book called Weapons of Math Destruction by Cathy O'Neill that's kind of popular in the mainstream. That discusses these things, but the biggest source of bias is usually from the data, right? It's from the data itself. So it's just to spend a lot of time creating your own data and collecting the data and have what I mentioned by what I call data empathy.
Okay, this, I don't know if this might be an interesting question. Raif is asking, analyzing data needs deep understanding of the local culture. Who are the leaders in Arabic AI? Can you name some countries and companies and universities?
Yes, so I mean, NYU Abu Dhabi is a good place to start. There's one new faculty member there, Dr. Tuqa. She's just joining from MIT. She's excellent. She works in healthcare. Definitely a good resource. Azza Abu Zaid, who's also at NYU Abu Dhabi. She works in big data and databases, phenomenal researcher. Definitely a resource for the community. The Qatar Institute, QCRI, the Qatar Computing Research Institute, has probably the best Arabic language, natural language processing group, as far as I know. It is led by somebody who left Carnegie Mellon University to join them. And as some of you might know, Carnegie Mellon is one of the best AI universities in the world. So they do a lot of Arabic transcription, a lot of Arabic natural language processing, NLP. So those are the ones probably. I mean, Kaus University in Saudi Arabia probably has some as well. I'm not familiar with exactly what they do, but I think in general, as a general rule, obviously there's culture and there's language, right? So there's those two things. And like, for example, the way young Middle Easterners use social media is very different. The way Chinese users use social media is very different than how Americans use social media. So there's that as well, right? So like, you just have to have people who are ingrained in the context. That's what I mean by domain, is that you understand the culture very well. So for example, with the hand washing exercise, maybe the algorithm is going to flag people. Maybe some women are, wearing niqab and wearing gloves. And the reason why they didn't sanitize their hands is because they are wearing gloves. So the algorithm will flag them and maybe it will do something to them, etc. But if you are a developer with that cultural sensitivity, you could inject that cultural knowledge into the algorithmic decision making.
Okay. Doctor, I'm going to wrap up with the final question. I know it's really late there in California right now, so this is the last question. It's a simple question, yet I think a lot of people are looking forward to this answer. Okay, so this is a question from Khadija. Why big data did not predict this pandemic?
Because we were not measuring, we were not looking for two reasons. There is no big data around that pandemic. And then number two, we did not invest in the infrastructure to take any pandemic seriously. And then number three, even when the data was there, remember what I said about the so what? When the data was there and people could see that it was pandemic proportions, people did not act. In fact, today in the New York Times, there was an article that showed that delaying some of the strongest shelter-in-place measures that were applied in the United States by a week cost the United States upward of 30,000 lives, right? Just 1 week of delaying the decisions to take in the pandemic seriously. So it's the data, the infrastructures, and the decision-making based on that data we're lacking. And that's, so it's not so much about predicting, but more about acting at that point, because the disease had already spread. But there was no infrastructure in place to monitor those things automatically. But there are techniques that do that, right? So for example, if you have a bank account, your bank will call you if there was like suspicious activity in your bank, right? They see like the spending is just, it's called an anomaly. So there are anomaly detection algorithms. So technically, if you were measuring the right data, as the anomaly started appearing, a system could fire an alarm and say, hey, watch out, there could be something going on here, and you could intervene. This is all hypothetical because we don't have this infrastructure in place. But it would be a very easy thing to spot if we have the right investment in place.